Welcome to RK Edu Nexus. Our channel is dedicated to helping you achieve your dream career without spending money on coaching centers. Are you ready to become a nursing officer without attending a coaching center? Let's get started. These exams are highly competitive and require effective preparation. Let's explore some tips and strategies to help you succeed. Practice is key to success. Make sure to allocate enough time for practice and revision.
What is the cerebral tissue perfusion pressure, CPP, when the blood pressure is 93/63 mm of mercury and the intracranial pressure, ICP, is 19 mm of mercury? A. 54 mm of mercury. B. 63 mm of mercury. C. 76 mm of mercury. D. 93 mm of mercury.
क्वेश्चन में ये पूछा कि यदि रक्तचाप 93/63 पारे के मिलीमीटर हो और इंट्राक्रेनियल प्रेशर ICP 19 मिलीमीटर ऑफ मर्क्यूरी हो तो सेरेब्रल टिश्यू परफ्यूजन प्रेशर CPP क्या होगा? And the answer is option 54 millimeters of mercury. Let's know how it is. Cerebral tissue perfusion pressure CPP is the pressure required for sufficient blood flow to the brain. CPP is calculated by subtracting intracranial pressure ICP from mean arterial pressure MAP.
तू समझा? हाँ। नहीं, तू समझा नहीं।
सबसे पहले हमें MAP यानी मीन आर्टीरियल प्रेशर के बारे में जानना होगा। MAP का मतलब है मीन आर्टीरियल प्रेशर। इसे निकालने के लिए हमें दो अंग्रेजी शब्दों का उपयोग करना होगा, डायस्टोलिक प्रेशर और सिस्टोलिक प्रेशर। मीन आर्टीरियल प्रेशर MAP की गणना के लिए हम निम्नलिखित सूत्र का प्रयोग कर सकते हैं। MAP इक्वल्स डायस्टोलिक प्रेशर जोड़ सिस्टोलिक प्रेशर डायस्टोलिक प्रेशर गुना 1/3। यहाँ डायस्टोलिक प्रेशर हमारी दिल की सामान्य चिपचिपाहट का माप है, जबकि सिस्टोलिक प्रेशर हमारे दिल की मांसपेशियों को जब ये प्रेशर सबसे ज्यादा होता है वो स्थिति होती है। एक बार जब हम MAP को निकाल लेते हैं तो अब हम CPP यानी सीरियल प्रेशर ग्रेडियंट इंट्राक्रैनियल प्रेशर के बारे में जान सकते हैं। CPP सीरियल प्रेशर ग्रेडियंट इंट्राक्रैनियल प्रेशर की गणना के लिए हम MAP और ICP इंट्राक्रैनियल प्रेशर के बीच का अंतर निकाल सकते हैं। यहाँ
Thanks. Love you. Forever.
And for additional queries, search on YouTube RK Edu Nexus, and get brief note on topics. Join our Telegram channel, same name RK Edu Nexus.
Which of the following terms is used to describe a sudden fall in temperature? A. Crisis. B. Lysis. C. Relapse. D. Quotidian.
And the answer is option A, crisis. Let's know something. Lysis is disruption or rupture of the cell membrane, resulting in the removal of cell contents or the death of the cell. True crisis. With the fall in temperature, there is a drop in the pulse rate. False crisis. A sudden but temporary change in a condition, such as a drop in temperature in a patient with fever.
Which of the following organs, glands is responsible for temperature regulation? A. Lungs. B. Pituitary gland. C. Hypothalamus. D. Pineal gland. And the answer is option C, hypothalamus. And the hypothalamus acts as a control center for thermoregulation by monitoring the body's core temperature and responding to changes in external conditions. It receives information from temperature receptors located throughout the body and coordinates various physiological responses to maintain a stable body temperature.
Which treatment option is typically used for a client diagnosed with pernicious anemia? A. Thiamine. B. Iron. C. Vitamin B12. D. Folic acid.
And the answer is option C. vitamin B12. Keep practicing regularly with us. And thank you. See you tomorrow.